Today discussion is lymph node. Now, the mother comes complaining that, see, my child is having, একটা গুটি দাঁড়িয়েছে, একটা গুটি দাঁড়িয়েছে, गिल्टी दाड़ा है इधर खड़ा इधर ear and in the inguinal region. Now, the child is brought to you, and with these type of things, they want one small submental lymph node, or posterior auricular lymph node, or a lymph node over the parotid. These are all you have to ask, what is it? Don't think of some lymphoma or some malignancy. I'm just telling you the basic of the lymph node, what you will manage and how. When you just say, open and see the inguinal region, and you go, just ask, did this child get a impetigo or boil, boil, or some infection? Then what is the lymph nodes? It's the lymphatics. The lymph nodes is the barrier, is the policeman. So it enlarges. Now you have to assure that the patient, the child, is not suffering from any disease or something. She suffers from disease, but he or she suffered from some complication in childhood, or or 6 months is a child of 1.5 years or 2 years old, or a kid. Then with this type of inguinal lymph nodes or your lymph nodes in the neck region, then you have to do some investigations. Most you do CVC and complete hemogram if you want to know any condition of the lymphoid tissue, malignancy or something like that. It can be in lymphoid, lymphoma, leukemia, all this. Now, that you have to segregate. Then if you have to ask the history taking is very fundamental, and that is the key to your diagnosis. So you have a big abscess, a child had a impetigo, lots of small skin affection, then that drains into the lymph node. That lymph node does its job. Now, this is one thing you have to understand, that if anyone comes with a swelling over here, হ্যাঁ এখানে কোনো ফোড়া হয়েছিল, এখানে কোনো অ্যাবসেস হয়েছিল, হ্যাঁ একটা ফোড়ার মতো হয়েছিল. Now these are the things you have to correlate, and that is why I have put a slogan there: anatomy is your gateway to medicine. It is not the thing that you have to just ignore anatomy. Because one thing I tell you, even in physiology, the heart you have to know. Every organ, anything, pathology you do. But one thing I tell you, that lymph nodes, today you will see there, ho jayega. So one thing I tell you, Last, I'm telling you, you have to give your khata till date by next week. Whoever signs, Subramai signs or Abhijit sir signs or myself sign, you just give it. Which batch, which you complete your work, please, please, please. You have to do it. Now, what I told you, that things are rapidly being discovered and changing, and in especially medical science. But the basic fundamental has not changed. Your robotic surgery and thing, everything is going on. How many robotic surgeons in India are there? ওসব স্বপ্ন দেখো আর বাইরে যাওয়া ভুলে যেতে হবে। ও আমি তো একটা সার্টিফিকেশন হয়ে যাবে, তোমাকে বাজিয়ে দেবো। তুমি কর্পোরেট হসপিটালে মেডিকেল অফিসার হিসেবে চাকরি করতে গেলেও ইউ হ্যাভ টু প্রুভ ইয়োর সেলফ। হ্যাঁ, দাদা দিদি বাবার বন্ধু কেউ খাতির করবে না। তুমি পেশেন্টটাকে দেখে কি কোথায় রেফার করতে হবে, দ্যাট ইজ দ্যান MBBS জব। বাট খাতা মাস্ট বি সেন্ট, বি রেডি, because see, why I'm telling you, month of May you will be having your exam, practicals, তাই তো, Thursday, Friday, Saturday. So you have to be শেষ করে দাও এই দুদিনের মধ্যে রাত জেগে। যেমন তোমরা এস্ট্রেলার ফাংশনের জন্য যতটা জোশ নিয়ে কাজ করেছো, ইউ মেক ইট আ টার্গেট যে না আজকে রাত জেগে দিন জেগে একটা খাতা আমি তৈরি করে জমা দেবো। আই উইল সাবমিট মাই খাতা। দেখবে হেডেকটা হাত দেখ চলে গেল, আর নালে দপ দপ করতেই থাকবে, এমনি করে আসবে, স্যার সাইন করুন, তারপরে জমা পড়েনি ছবি। There is one thing that few people are drawing diagrams, but a diagram without a label, without a legend. Legend means this is the histological feature or HN stain of lymph node. Okay, one thing now, বাবা তোমরা একটু দেখে নাও, আমাদেরকে গালাগাল দেবে? আমাদের গালাগাল দিলেও হবে, কিছু হবে না। Now, small kidney shaped structure that filters lymph. Lymph node has convex surface and concave area of hilum. Each lymph node receives lymph through the many afferent lymphatic vessels. Each lymph node has efferent lymphatic vessels through which filtered lymph leave the hilum. Lymph node receives blood vessels through the hilum. Just see the vessels going through the hilum. And you all finish abdomen. Abdomen হচ্ছে inguinal region হয়েছে। How many of you seen the lymph node in a dissected body? Raise your hand. How many of you have felt it? Have you felt it? Touch করেছো, দেখেছো, ফিল করেছো? ঠিক আছে, তাহলে 40 জনের মধ্যে 10 জন আমি বেশি করে নিয়ে নিলাম। What is the feeling? Now, what is the feeling of chronic inflammatory disease of the lymph node feel of chronic disease? Or it's just a inflammatory, due to inflammation it is happening all this. Now what I want to say is that you have to feel, touch, feel. Every time I told you, you feel. In our days we didn't have so much gloves or something like that. এমনি করে ধরবো, ডাক্তারি করবো, একটা লোক পটি করে দিল, গায়ে পটি করে দিল, লিথোটমি করে দেখতে গেলে একটা মাদার তোমার নর্মাল ডেলিভারি করাচ্ছ, সেখানে তো পটিতে আর ইয়েতে লাইকারে ব্লাডে একবারে it is mixed up. You cannot do doctor like this. Heart. I told you that this is the best instrument. You have to feel it. Feel this tissue texture. You see, you do a per vaginal examination. I will, with my experience, I'm telling you. Yesterday I saw a lady from Jharkhand. So Now, the two cervixes. If you do a part vaginal examination, then you will see that this is bulky. It is thick, but this is like this. This is more or less normal, but this has been like this. It is like this, stand up like this, curled up like this. Then what would be your suggestion to the patient? You can feel it, but you do a speculum examination, which most of the gynecologists who are going from one clinic to one clinic, one shop to one shop, they don't have the time to, or they don't look into it, the speculum examination. But my teacher, I did internship in 3 months, internship in gynecology. But I have been doing gynae practice. I think many of my age or my juniors, they didn't encounter so many complicated gynecological cases. By feeling, you feel and see how it is. How it is the normal touch. If you don't know the normal anatomy, then how will you suggest this should go for an ultrasound, pelvic organs, plus your TVS, transvaginal sonography. The probe is put into the vagina and the image is taken. Now, I had ordered the previous 2 months back, but she came yesterday after with a ultrasound. And I always illustrate in my prescription that this finding matched it. So what they asked me, what we should do. I told them, have you children? Well, I have 2 children. Then I told them that you go for an operation. They'll come after 1 month. Now I'll be doing a hysterectomy operation. Then I will send the tissue, but the feel, I'm sure it is just inflammatory, but that can turn into chronic inflammatory. It can turn any time to malignancy. So I'll be doing excision and then send the tissue for histopathological examination. This is one school. Another school is that you take a pap smear, see if it is this thing, but that is pap smear is not always very authentic. So you take a punch biopsy before going for the hysterectomy. You have to feel it, you have to see, you have a lifetime chance of, you might become a medicine doctor, but then too you have to feel the glands. You have to, say in the neck gland, you have to palpate, you have to, thyroid. You have to swallow and then you see the nodule. Then you go for your thyroid test. Now these things are there, assist us. It is assisting us. Even I am a part of you. When you become a doctor after 5 years, you will be taking the help of all this. But your clinical knowledge should be sound. So don't add a nodule. Now how will you manage this? She's come for one in this inguinal lymph node, boy aged around 11 years. the grandmother, এটা কেটে বাদ দিন, এটা কেটে বাদ দিন, না আমি then I did just to um, for your one ultrasound, one FNAC, fine needle aspiration cytology. This is one thing, is that to satisfy the grandmother. She's so panicky. That child is the only child and all, but your blood will reflect. Okay, you can take, when you are in a dilemma, then you take the biopsy. It's a small tissue. You just make a small incision under local anesthesia and take it out and send it, formalin fixed session, and you send it to the histopathological unit, and you give medicines for whatever she might be having, a chronic cough, cold, then allergic rhinitis and all this due to pollution and all. So it is not that only you write paracetamol, you write something. আর যদি তুমি চারটে ট্যাব নিয়ে ঘুরে বেড়াও, এটা আমার রোবোটিকের গল্প বলবে, এটা আমার এটার বলবে, এটা আমার এআই নিয়ে চ্যাট জিপিটি করতে করতে পেশেন্ট হাওয়া হয়ে যাবে। এইরকম একটা আউটডোরে তুমি যখন ভিড় হবে, তোমার চেম্বারেও যখন ভিড় হবে, তখন তুমি ওই চ্যাট জিপিটি করে কল করতে গিয়ে তুমি ওটা তুমি রাত্রে নোট দিয়ে রেখে দেবে, ইউ কিপ নোট অ্যান্ড দেন ইউ কনসাল্ট ইয়োর this thing. This is one thing. Second thing, now histology of lymph node, section of a lymph node shows capsule, this is the capsule, and subcapsular sinus, outer cortex and paracortex, this is the cortex, and subcapsular sinus, trabecular sinus, medullary sinuses is in the medulla, and you see the vein and the artery and the afferent lymphatic vessels. And afferent lymphatics, now the capsule is here, trabeculae, and superficial cortex, deep cortex. Capsule, lymph node is covered by connective tissue capsule. It is made up of dense connective tissue. Trabeculae extends from capsule in the substance of lymph node. Now you see, this is the lymphatic nodule. This is the trabeculae, here this, the lymphatic nodule, this is the lymphatic nodule, and subscapular sinus, this is the capsule, and this is the subscapular sinus. And you see this is the superficial cortex, deep cortex, medulla. Now see, this is the panoramic view. Superficial cortex, deep cortex, medulla, this is the capsule. Now trabecular sinus, capsule, subscapular sinus, and you can see the lymphatic nodule here, and germinal center is here. And you see this in higher magnification. Now let it be there. You come in groups and see, come back, and just review this thing with your tab or whatever it is. You please do this. আর তো কমাস, অগস্ট পরীক্ষা ফাইনাল, সেপ্টেম্বর তো ছেড়ে তার অগস্টে তোমার তো অগস্ট পর্যন্ত, I mean মে জুন, মে তো পরীক্ষা হয়ে গেল, জুন জুলাই, you have to 3 months. 3 months এ তোমার কতগুলো পার্ট আছে, তার মধ্যে হেড নেক, পরে হেড নেক শুরু হয়ে যাবে। Don't panic, I'm telling you, you still have the gadgets, use it intelligently. You hear from the teacher who is speaking to you. It might be X, Y, Z, anyone of any department. আর যদি ভাবো যে না আমরা হয়ে যাবে, তাহলে তো এটা তোমাদের ব্যাপার। হ্যাঁ, আর বলা আছে, one thing I tell you, if you have any, you want to revise in these few days, now you will be busy with your exam. Naturally, in case you are coming or you go for a holiday, I don't know what will be announced, but if you have the time, if you are coming to the department, you see Rocky, এরা যদি হিস্টোলজি দেখতে চায়, হ্যাঁ, তাহলে তুমি ওই খাতা দেবে, একজনকে দায়িত্ব দেবে, and you sign it and again return the slide, because we are shortage of slides. One thing. Another thing is that very first day when I told you that how to handle a microscope, one of your friends by accident, that is why the accidents occur, because you are not, oh ho jayega chalo, you are standing like this and a microscope kore dichcho. You sit down or stand, whatever, you rest, keep your book, your tab, everything. Then you see, and then accordingly you just move the stage, micrometer stage. Now what she did, this slide was here, she put up the stage and then got cracked. It is very difficult to get histological slides. It is your asset, your property. এই ফিলিংটা you have to have it. ও তো আছে, আমার ইয়ে দেখে নেবে, মলয়বাবু দেখে নেবে, আমি এত টাকা দিয়ে পড়ছি, আমার এই করতে হবে। এই অ্যাটিটিউডটা ঠিক না। Attitude is that it counts. All that counts is attitude. So you just don't destroy anything. Please see. কারণ এই করতে করতে আমাদের অনেক স্লাইড ভেঙে গেছে, just due to your not being focused with what job you are doing. কারণ these small mistakes will carry you with you. And you will be operating, ওখানে একটা গজ পিস ঢুকিয়ে রেখে দিলে, just say neurosurgical operations. Earbuds দেখেছো? Earbuds. Now 50 cotton, this thing, swabs. My Professor Thomas told me, he was a neurosurgeon, মানে Adi, primitive, when this thing, he had a sister with him. He used to come to Bardhaman, Camry. So that sister used to count how many swabs the surgeon has taken. One piece, one small thing, if it is lodged there, because the surgeon is working and he might have not put the thing, but the count and check, recheck. I mean, I'm telling you, it is this component you have to think of. You see, জ্বর হয়েছে, you do like this. You have to act. অভিনয় করতে হবে, এইভাবে দেখে দিলে, লিখে দিলে। When you are a trainee, you have to, when you are a student, you have to study and correlate your this thing. This is the only chance in a lifetime that you are getting an opportunity to see things. Oh, I'm telling you, I'll be there in this district, and you will be knowing, yeah, what is the competition. ডক্টর অভিজিৎ স্যার বলছে, নার্সিংহোমে কাজ করাচ্ছে, 30,000 20,000 টাকা করে দিচ্ছে, মেডিকেল অফিসার হিসেবে এনরোল করা আছে, 30,000 টাকা। তার কাজের ব্যাপারটা তাহলে বুঝে নাও কিরকম জায়গায় আছে। যাদের রোল অনুযায়ী এসো, রোল অনুযায়ী এসো। So you have to deposit your this thing by next week if you can.